Hello, lovely viewers, and welcome to my channel. Today, I'm going to be talking about vaccines, specifically why they exist and why they're an essential part of healthcare. I know that today, in the United States, under our current administration, vaccines are kind of a polarizing topic. Vaccine development has faced a severe cut in funding, so I want to break down the mistrust of vaccines and really the whole healthcare system as a whole. Honestly, we as a country have pretty much lost all trust in the healthcare system. And granted, obviously our healthcare system needs to be improved. I just don't think that by attacking one of the most basic areas of healthcare is the way to do that. So first, let's talk a little bit about why vaccines even exist. I'm sure you've probably heard of smallpox because it was an absolutely devastating disease that has existed alongside humans for thousands of years. So naturally, leading scientists wanted to find a way to at least get some sort of resistance to it. Even if you survived smallpox, you often had all sorts of devastating, long-term side effects, like blindness. If you were pregnant, and you got smallpox, children could be born deaf. Yeah, and it also had a 30% mortality rate, which is not good. That means that 3 out of every 10 people that got it would die, and the ones who survived wouldn't exactly be the same. It was also the primary disease that wiped out 90% of Native American populations whenever the Europeans came over to the Americas. In 1796, a doctor named Edward Jenner observed that milkmaids who were infected with cowpox had some immunity to smallpox. He tested his theory by creating the first prototype of vaccine known as variolation. Variolation basically was where you would deliberately infect individuals with a mild form of the disease. They basically would take samples of patients who had smallpox, and they'd take sores or scabs, and they scratch patients so that they would have a mild variation of the disease, so it wasn't quite as lethal or problematic, but it gave them some immunity to it. In 1959, the World Health Organization made it its mission to eradicate smallpox. There were a lot of struggles though, because there was a pretty severe lack of funds and also vaccine supply. And on May 8th of 1980, the world was decreed free from smallpox. In the modern day, however, vaccine rates have severely declined, at least in the United States. And this is partially due to the COVID-19 pandemic, when we saw this huge rise in anti-vaxxer. Really, it just led to this huge spread of misinformation, and then people just started not trusting vaccines, and so we have seen a significant decline in especially childhood vaccinations, which is really problematic because, as we saw with the West Texas measles outbreak, these diseases, they're not just a little cold. They can kill you. They can be fatal, especially for young children who do not have an adaptive immune system yet. There are two main types of immune system responses. You have the innate immune system, which is what you are born with and is mostly influenced by your mother's breast milk. The immune system you get from your mother is present at birth. And then the adaptive immune system is basically what you gain it over time. So when you face the flu, for example, your body, your immune cells will learn this pathogen. They will discover how to fight it. And the vaccines work the same way, by giving you basically inactive form of the virus so that your body can recognize it and know how to fight it, but without having it basically take over your body. It basically prevents hospitalizations and other severe complications from happening in the future. It does not mean that you won't get infected with it in the future, because viruses mutate. Granted, not all mutations are helpful, but the ones that are helpful will help them survive. One key thing to note though about vaccines is that vaccines do not prevent against bacteria. bacteria are a completely different type of organism altogether. The antibiotics work for bacteria, but don't do anything against a virus. There is nothing that you can take to treat a virus. But you can take vaccines that can prevent you from getting severe complications from a virus. That is what they are. Vaccines are preventative medicine. They are not a cure-all. That's just not how they work. They give your immune system basically instructions for how to deal with a virus. They're not gonna help you 100% of the time, like Lysol. Lysol is like 99.9% effective against germs, not 100%, because nothing in life is 100% effective. In the United States, our health secretary at the current moment under the Trump administration is Robert F. Kennedy Jr. And he is a very controversial figure. Since he has been health secretary, he has eliminated many essential areas of the CDC and the FDA, and he spread a lot of vaccine misinformation, specifically about vaccines causing autism, which the funny thing about that is that was a study that couldn't be repeated and was proven to be false. And the one who completed the study, he had his whole license taken away. It was a whole thing. But yeah, it has been disproven many times. Vaccines do not cause autism. Autism is almost certainly genetic. Speaking of the measles epidemic, he suggested that patients take vitamin A to prevent measles instead of a vaccine. Yeah, that just doesn't work. Sure, vitamin A is an essential vitamin, but you can get toxicity from that. Vitamin A is a fat-soluble vitamin, which means that it stores in your fat, unlike vitamin C, which is water-soluble. If you take too much vitamin C, you will flush it right out. Vitamin A, and I believe there's 3 others, if you take too much of it, it's just going to be stored in your body, and it's going to be extremely toxic to your liver, to your kidneys, to everything. It's just not a good idea. He also stated that anyone can get the COVID vaccines this fall, but just a few weeks ago, I went to get my flu shot, and I was like, yeah, why not get a COVID vaccine? It's probably going to be my last chance to get one anyway, and I was denied because I was not immunocompromised or 65 years of age. So it disproves what he said by anyone being able to get the COVID vaccine. You can't. They have made such changes to who can get it for no reason, honestly. I feel like if you want to get a vaccine, you should be able to get a vaccine. There shouldn't be restrictions on who can and can't get a vaccine, especially for something like COVID or the flu or something that is very prevalent and also extremely transmissible. Like shingles is different, but you know, COVID-19 is still prevalent today. You think it's just disappeared? No, that's not what viruses do. They linger around like a really annoying cyst.
Hello, I am Robert F. Kennedy Jr. and I am the Health Secretary of the United States of America. And we have noticed a significant rise in viral illnesses that were previously manageable, and so I have decided to cut spending in various research areas of the government that are concerned with this issue.
Won't that just make things worse? You basically just destroyed the foundation of government-based research in the United States and are enabling the spread of disease?
Oh, maybe, but there was a disproven study done by a revoked scientist that claimed that vaccines cause autism, and that's what I based all my information on. So, don't get the vaccines, take vitamin A supplements, and then you can go to the hospital for 2 issues at once. And then I get the credit for saving people's lives by spreading blatant misinformation. If anyone would like to disagree, I will give them a 5 minutes notice before their entire branch in the CDC is eliminated because disease prevention is wasteful government spending.
Oh my God.
There is no doubt that RFK and his associates' actions will cause devastating effects for the health of millions, not just today, but in the future. By eliminating these essential areas of government, he has also eliminated critical research into cancer, into autoimmune diseases, into various things that do kill millions of people every year. And I find it quite ironic that his campaign is Make America Healthy Again, when instead, he's just pretty much letting corporations do whatever in the world they want while eliminating the actual things that make people healthy. By choosing his actions, he has also reduced trust in public health care, and that is going to cause people to not seek doctors, and that's going to cause them to suffer and essentially die. However, most people aren't going to care about this until it directly impacts them, until it's their grandparents that get sick with something such as measles that could have been prevented had a kid has gotten a vaccine, and they die or they suffer severe hospitalizations. And if you're from the US, you know the healthcare system is expensive. So why not get a cheap vaccine now that will help potentially save you thousands of dollars in the future and save lives? Anyways, if you found this informative or helpful, or if you just thought I was gorgeous, you can subscribe if you want to. Anyways, stay safe and get your vaccines. And don't eat a whole bunch of vitamin A. That's just stupid. Alright.